Hello, everybody. Welcome back to the Fertility Confidence Podcast. Today, we're talking male fertility and bacterial infections. But before we do, I want to share a little bit about what is bringing this episode to your airways, because I am deep in this rabbit hole right now around immune function and fertility. And you've probably heard me say this before. And if you're one of my clients in FCM, you absolutely have heard me say this before, that there's so much about the immune system just in general that we don't know, but coupling how the immune system impacts infertility, we really do have like a very, very minimal understanding of how all of those pieces interact. Can we do testing? What does that testing look like? What does treatment look like? We don't have a lot of research in this area. But when we peel back the layers and we go back to the basics of fertility, what has to happen for that process to be successful, and not just fertilization, but also implantation and then a healthy pregnancy all the way to a live birth. Asterisks here, all of our research that we want to use, we want to see improvements in live birth, not just pregnancy rates. We want to know that we're reducing the potential miscarriage rate as well. We're actually improving live birth rate. But the way in which all of that happens, and then what we actually need the immune system to do in order to promote implantation and a healthy pregnancy, or what we need the immune system not to do, there just becomes this whole other bucket of information that I'm really coming to this realization. And I have been in this realm for many years, trying to just understand it deeper, trying to help my clients advocate further when it's something that a lot of clinics are brushing off or saying like, oh, let's try this first and then maybe we'll have this conversation. When the reality is that if the immune system is a problem from day one, it's going to be a problem after 3 IUIs. It's going to be a problem after 2 IVFs. It's still going to be a problem. So we actually should be changing the flow in which we do testing to look at the immune system from the beginning. And a belief that I have and am really starting to roll with and try to find more and more information about is the fact that a lot of couples who've been diagnosed with unexplained infertility likely have an immune problem. And we get into how the uterine microbiome is likely playing an impact. But the other day, I was thinking about, how does this impact sperm? I have been putting together a little bonus video on how sperm can impact miscarriage, because a lot of times we assume after a loss has happened that there's something wrong with the uterus. There's something wrong with the female because she's the one actually trying to carry the pregnancy. But the reality is that sperm is 50% of the genetic equation. Sperm can influence miscarriage. So if you want to get your hands on that little video research brief, make sure you're following me over on Instagram at Fertility Confidence Method so that you don't miss out when we launch that. But that's a sidebar. I was putting that together and I started asking myself the questions around, we talk a lot about, I in my head have this dialogue around uterine microbiome. I'm like obsessed with the uterine microbiome right now. And it made me go, what about like testicular sperm microbiome? What about bacterial infections in men? And so that's what today's little research brief is about. There's a 2021 study breaking down how bacterial infections influence male factor infertility. And I'll share the PubMed ID and link for you in the show notes so you can actually go and read the article yourself. But I want to give you like the Coles Notes version here of why we care about this, why we want to start asking these questions and having these conversations, and what does that actually look like to rule this aspect in or out. So if you are someone who is not getting anywhere with male factor fertility, you have known male factor fertility, you've seen your semen analysis results, your results don't look good, if you've had an essay done and you actually don't know what the numbers are supposed to look like for optimum levels, I highly recommend checking out Fertility Labs 101. And you can do that at ttc.kelseyduncan.com/fertility-labs, because it'll walk you through the optimal levels that we want to see for both men and women, sidebar, but we're talking just about semen analysis right now. If you're not getting anywhere with the treatment plan that you're using, and you know you've been really compliant, we've been doing the things, and we're still just not seeing movement, we might want to dig into chronic infection and immune response. It's one thing, and I'm guilty of this as well. Whenever we see poor numbers, we automatically just assume there's something wrong with testosterone. Testosterone is driving the ship when it comes to actually making sperm. If we're not making sperm, there's something wrong with testosterone. But the reality is there's other root cause pieces that might be going on. It might be a testosterone issue and something else. It's the same with why we want to take a whole couple approach to fertility. If you have a known female factor diagnosis, we don't want to let your husband or partner skirt by without testing because it can be both. If you have a known ovulatory issue, we can still have an inflammatory issue or an immune issue or something else. We can still have multiple pieces. It's a complex problem that we can reduce the complexity by taking a whole couple holistic approach. So we might want to dig into this aspect of chronic infection. So what do I mean by that? Every couple who's had like a bare bones fertility assessment done typically is also screened for chlamydia and gonorrhea, the two more common sexually transmitted diseases. A lot of times couples will be like, we don't have that. Like we assume that it's just like this bad thing and whatever. Doesn't matter. That's all we screen for though. And a part of that screening, yes, comes from the fact that we know past history of or current chlamydia or gonorrhea infection can impact fertility. It's unfortunate because the blood test actually doesn't assess for past infection. And so we'll talk a little bit about why that matters. And screening for those two pieces is important. I'm not saying it's not, but there's more to it than that. There's other bacteria that actually can be impacting the male reproductive organs and the important cells, the Leydig cells and the Sertoli cells that are crucial for spermatogenesis. And we could have had these infections years ago and still be dealing with the damage downstream. So beyond chlamydia and gonorrhea, we want to look at things like ureaplasma, Pseudomonas, E. coli, staph infections. These are other big pieces that you could have picked up along the line that aren't sexually transmitted diseases that might be impacting sperm health. And I want to actually step back to the ureaplasma and even the Pseudomonas, but we actually see more research in the ureaplasma. This is something that has really come into our circle in the fertility world more over the last couple of years as a potential cause for unexplained infertility. And there's one paper in particular that was looking at unexplained female factor fertility specifically. They didn't look at it in men. And they found something like 45% or maybe higher of women who were diagnosed with unexplained actually had a ureaplasma infection in their uterus. So looking at the uterine microbiome has really become a big thing that we're actually pushing our clients to have assessed earlier, as early as possible. Not after you've had 2 failed IVF transfers, which is when they might start looking into it. We want to look into that right away. And ureaplasma is something that is not technically a sexually transmitted disease, but a couple can actually pass it back and forth. So if we find that in a semen sample, we assume that there then is a ureaplasma infection likely in utero. And so we want to make sure that we're doing these assessments both ways and treatment both ways. So I just wanted to give that little asterisk because you might have heard me talk about ureaplasma over on Instagram before for female factor. It's the same for male. Okay. Why do we care? How do these things actually impact our fertility? There's 1, 2, 3, 4, 5, 6, 7. 3 of them are kind of similar. So let's say 5 main reasons why we care. Okay. First and foremost, any of these infections, whether you had them before and they've cleared or they're current, can lower spermatogenesis. Spermatogenesis is the way your body makes sperm. So basically decreases your body's ability to make sperm, which if you have low count, we obviously are thinking that that's happening, right? If your count is optimal, not just normal, but optimal, you might not necessarily have a problem with actually making sperm, but now we're looking at the other pieces here. Okay. Does that sperm have good motility? Are we able to see a good portion, over 65% of those sperm swimming quickly and straight and forwards? If you've ever seen sperm in a petri dish, a lot of them swim around in crazy circles, and it literally explains everything. And you're like, why aren't these sperm like lined up single file, knowing exactly where to go? They have no idea what the fuck is going on. Honestly, it's ridiculous. It's like a circus, truly a circus. It's why you need billions and billions of sperm, because most of them are never going to make it. They're just never going to make it. So bacterial infections can decrease sperm motility. They have a long journey. Sperm have to find the cervix, get through the cervix, swim to the back of the uterus, find a fallopian tube, one on each side. It's not like the whole back of the uterus is just this open highway. They have to find the hole. They then have to get into the fallopian tube and find the egg. They have to do all of that before the egg actually exits the fallopian tube. Once the egg is out of the fallopian tube, there's no opportunity for fertilization. So they need to swim. They need to swim quickly, and they need to swim straight. And ideally, a decent amount of them are doing that. Not every single sperm is going to. Fine, that's okay. It's a flaw in our system, but it's the way the system works. But we need a good amount. Once this motility number starts dropping, we're now wondering, okay, there's an okay amount of sperm, but are they actually getting there? This is where IUI would come into play to help shorten the journey potentially. Fertility needs to be a whole couple approach. And the conventional approach to fertility is really hyper-focused on the uterus, and it wastes a lot of time not taking your other half into the equation. Male infertility contributes to about 40 to 50% of infertility cases. And while in mainstream medicine, the focus is placed a lot of times solely on the woman, her hormones, her test results, and the man is often only tested for the bare minimum, like basic semen analysis, and that might be it, and not other major contributing factors that play a crucial role in this entire TTC journey. His Confidence is our signature male fertility course that brings your partners back into the conversation and uses our no BS approach to fertility care with research-backed science and all the info that you need to start boosting sperm production and also quality immediately. You can learn more about everything that's included and covered in helping to build out your male fertility custom plan over at ttc.kelseyduncan.com/hisconfidence. The next piece is morphology. We talked about this last episode with Dr. Mark. Highly recommend going back and listening to that one. But it's possible that chronic or acute bacterial infections can decrease sperm morphology. And we have a small window of opportunity there. We have very low expectations of morphology. So even just a 1% difference with low or moderate sperm count, we're seeing a huge impact. When you have low count and we have low morphology, we're having an even larger gap in fertility success potential. So these are three big things: how we're actually making it, is it swimming, and what's the morphology like? What's the actual shape and makeup of that sperm? The other piece is DNA damage. And we talk a lot about this. I never used to bring this up. Honestly, I was like, not important because oxidative stress, and we're already doing antioxidants, yada, yada, yada. But the more and more we dig into the research, specifically also the research around how sperm impacts miscarriage, we're seeing this aspect of DNA damage starting to be talked about more and researched more, which is awesome because the semen analysis only shows us one little snapshot. We could have good count with decent swimmers and good morphology, but we could have a large portion of those sperm that on the outside look normal, and there's a lot of them, but internally the DNA integrity is flawed. So that sperm might make it to the egg to fertilize, and it might actually fertilize, but when the process of division starts happening to actually create the blastocyst and move through the whole shenanigans of fertilization and creating the embryo, that DNA, if that's not of good quality, if all of the chromosomes aren't there and perfect, that's not going to complete. So either there isn't going to then be implantation, or maybe there's implantation, but we're dealing with loss. That DNA damage is an important factor. And with bacterial infections, we're seeing an increase in oxidative stress and inflammation, and both of those things can contribute to more DNA damage in the sperm. So even if you have a good semen analysis, it's not the whole picture. And we do talk about that in previous episodes as well. And then the last two being inflammation and just overall tissue damage. So with bacterial infections and the way that you need to mobilize the immune system to get rid of the infection. That is how our bodies are built, and it's a good process. But if we can't clear that infection, or we're just constantly getting hounded with these immune cells, we're then potentially leading to actual tissue damage in vital pieces of our reproductive organs, in the Sertoli cells or the Leydig cells, maybe even in the tubes that carry the sperm to the seminal fluid. Then maybe you're making sperm, but it's actually not getting to where it needs to be. Maybe there's blockages in those tubes. This is also why a physical exam is really important to rule that out. It's the same with inflammation. The immune system response is important. Inflammation, when we're clearing an infection, is important, but it's that long-term, that chronic, that long-standing inflammation, that overactive response potentially with the immune system that's going to cause a problem. So the inflammation, in theory, is a good thing in that short burst. For men or women, anytime you get sick, your body's going to respond with this inflammatory response. We need that to happen. That's okay. It's going to bring these inflammatory cytokines to the site. It's going to bring things like TNF alpha and interleukin 6 and interleukin beta. You'll read about those in the study if you open up the paper. But when we have those cytokines present, and it's not just for potentially a short period of time, because maybe the body couldn't actually clear this infection, maybe there's been multiple, maybe it's been long-standing, and you might not even have a lot of symptoms, maybe it's quiet in your body, then over time, they're actually going to shut down and inhibit the Leydig cells' ability to make testosterone. They're going to create what we call cellular apoptosis, which technically we want to happen to get rid of the bacteria or the viruses. But if, again, it's there for a long time, we're actually going to start having cellular death. That's what apoptosis means. It explodes the cell, basically. We'll start having cellular death in cells that we don't want to die. In our Leydig and our Sertoli cells, then we're going to have hormone production issues. It's actually going to increase oxidative stress in the body. And we're going to talk in a second why a little bit's good, but too much is not great. So we have this breakdown of like, this is okay, but for a short period of time. And if we're not actually clearing these infections the way that we should, which we do see in our society, that I think we just have more long-standing bacterial and viral, like chronic infections. I see it in clients in private practice, even outside of the fertility world, that our immune system just wasn't able to clear, and our body kind of like learns to live with it in a way. But because our immune system is sort of always kind of activated, we're now then getting into an imbalance of a Th1, Th2 response, which then we know for fertility is not great. Let's circle back to the DNA damage really quickly, just to make sure that I kind of covered that. The bacterial infection can impact the cellular membrane structure and change it. So the way that the cells inside the sperm are supposed to communicate with the egg, that might not happen appropriately. We can have chromosome breakage. Chromosomes are like the actual DNA pieces. They all need to meet with their partners in the egg to then create an embryo. If there's a chromosome that's damaged, then that embryo may not be compatible with life, or may not be able to continue the process to keep dividing because there's too much damage internally. Can also impact mitochondrial health. We know on the female side of things that the ovaries are rich in mitochondria, that they're so important for egg quality, just as important for sperm quality as well. So if there's a downregulation in how mitochondria actually function, then the male body is not making as much energy, as much ATP as it should. It can't clear the oxidative stress the way that we want it to. So now we're having that long-standing impact from potentially an infection that's already gone. We care about that. It's so important. The outside of the sperm is what we see on a semen analysis, but the inside of the sperm is actually what matters. So it's really important to get an idea. Again, if you're not getting anywhere with your treatment plan, or things aren't changing and we have no male factor, These are pieces we want to start asking questions about. The body intuitively is built to eliminate oxidative stress because we are going to have normal levels of oxidative stress in our body. But when that level of stress is too high, that system that we've built, it becomes overwhelmed. That's probably the best way to put it. Same with any system in our body. Truly, our liver has this capacity to work through and eliminate waste products and toxins through our system. But if we're constantly pounding it over and over and over again with other pieces that aren't in its like daily routine, it's going to impact the daily routine. It's the same way with oxidative stress. And bacterial infection is just one potential cause of oxidative stress. Our lifestyle can actually play a really big role here. So looking at weight management, looking at quitting smoking, eating lots of fruit and vegetables, looking at your environmental toxin exposure. Are we exposed to a lot of EDCs? Are we exposed to things like parabens and phthalates and chemicals in our workplace? All of those things can contribute to higher levels of oxidative stress. So like I said at the beginning, if you've worked really hard on doing all of the things to improve sperm numbers and we aren't seeing the results that we expect, and you've been cleared from urology for like a physical blockage, this might be something we want to look into. This immune piece, this chronic infection piece, and or I would probably say and the DNA fragmentation aspect as well. Let's look for other acute or chronic bacterial infections, not just screening for STDs. I think this needs to be a really big shift in our more proactive care or our preliminary workup, knowing that truly it's such an easy fix. If we can clear the infection and rebalance the immune response, we're likely going to see an immediate improvement in sperm. And we know from the female factor side of things research, if we clear the infection, we typically do see a huge change in pregnancy rates, given that that's the one main cause for unexplained and not that there's other factors going on that also need to be worked on and improved. I know a lot of you are going to be like, oh my God, how do we know? If your fertility clinic or urologist is not open to offering you some sort of bacterial screening through a semen sample, then you can actually do this at home through a company called Fertility. I have no affiliation with them, but they do offer a female microbiome test that we've been using with great success inside Fertility Confidence Method. They also have a male factor microbiome test as well. So you would send in a semen sample. They look at 35 different bacteria and viruses. They also have a DNA fragmentation test as well. So that's something for you to look into if you can't get access to these pieces through your current care structure, your clinic or your urologist ideally. Then you have an at-home option for you to look at. If anything comes back positive, good practice is to test and treat both partners because you likely have been passing these things back and forth. If you're having intercourse, if you're trying to get pregnant, you obviously are. Okay. So we don't want to just assume the other person's fine. We don't want to assume because you have no symptoms whatsoever that this isn't potentially a piece on the table. Because like I said, you could have a ureaplasma infection and have no idea. You can have a staph infection that's old and just dormant and have no idea. You don't have to have all these like nasty STD symptoms that we assume we would have to actually be having recurrent oxidative stress, damage, inflammation internally. You might not even have pain or swelling. So these are things that regardless of symptomology, we want to be looking into and ruling out. So hopefully that was helpful. And we'll see you guys on the other side next week in our next episode.